It's a pleasure to have on the LGPro Corporate Partner Spotlight Gary Smith, the Manager of Food Safety Reform from the Department of Health and Human Services. Gary, welcome.
Thank you, Chris.
Can you tell us a little bit about the background to the Food Safety Reform program? How did it come about?
It came out of the Small Business Regulation Review, Retail, that was conducted during 2017. And they finally published their report early 2018. Had a number of recommendation areas. Most councils will be aware of the Better Approvals project, but the area amongst their reform recommendations where they highlighted there was the highest regulatory impact was in food safety. So they made a number of recommendations to improve the food businesses' experience of being regulated by councils. So it wasn't to change the laws, it was to better facilitate and give better tools for local government to help them to regulate more consistently across the state.
Tell us about the Food Trader program particularly, because you see that as a key tool in helping councils, as you say, be more consistent with the regulation of food businesses.
Yes, the major component out of the 5 food safety reforms was Food Trader. It didn't have that name back then, Chris. It was called an online portal and database. So we came up with Food Trader when we held a competition actually with councils to come up with the name. Right. Yes, the Food Trader system was to provide a single portal for all food businesses into councils, so a single source of truth for information. But taking into account that councils are the regulator, not the department, they would then go into the council's website where they would then, because councils have their particular nuances with town planning and local laws, so they'd still get access to that information. And then it was also the development of a back-end database for councils used to manage the regulatory functions associated with food businesses. It included a business account for the businesses, so all information, all account information, regulatory information would be with the business. And for the council officers, for the first time, they would have a web-enabled tool that they could take out into the field, access historic information about the business, and record regulatory information using a risk-based approach, which is a big focus of the department.
Do you see this being a compulsory tool that councils will have to use?
Well, competitive neutrality was one of the reasons why we didn't make it compulsory, because there are private vendors out there. So we're competing with the private market, which is why, and I think that was a good thing, because then we had to develop up something that councils would want. So it's been very much co-designed with councils. We held over 50 consultation sessions with councils. All councils bar one attended 2 consultation meetings that we held with a solution architect. So we've designed very much, this is probably one of the more user developed systems, definitely within the health department. And from the users, the council environment health officers, we have a 97% acceptance by council officers saying it's a good system. So we've convinced them. Next is to convince, obviously, the senior management of councils that it's a good idea.
Gary, of course, there's more than just food businesses that are part of the public health responsibilities for councils. Do you see this being expanded to encompass wider areas of responsibility?
Definitely. That was not the initial brief to Treasury to get our funding or the initial business case that was developed for this project. But again, because it was co-designed with council officers, they very much said that they wanted a more complete system, not one that just did food, so that they would have to keep separate IT management systems for other areas of public health. I don't know how much Senior Management Council realise, but there's 12,000 premises regulated under the Public Health and Wellbeing Act. And, that's the hairdressers, tattooists. We call it skin penetration, but, like the piercings, public swimming pools, prescribed accommodation, caravan parks. And we also, through representations from council officers and even the Municipal Association of Victoria, included tobacco regulation as well to make it a more complete system. I said very much we had to make this a system that councils want because it's not compulsory.
Tell us about the timelines for the rollout of this. You're, as I understand it, in the middle of the procurement phase, and in the first part of 2021, we're really going to see some activity on getting it ready for market.
Oh yes, will be. It's a very tight contract, which all the vendors at the moment know that they must deliver on. It's intended that the system will start for temporary and mobile food businesses on the 1st of July. So at the moment, we have a system called Street Trader. All council officers are aware of that. It's been around since 2012. That will be decommissioned. All 79 councils have been using Street Trader. Now it'll be Food Trader. And that's for the 20,000 temporary mobile vending machine and water carters in the state. For fixed businesses, which is the vast majority of businesses in Victoria under the Food Act and Public Health legislation, we're going to start with 8 to 10 pilot councils from July. That's why for them the system will be free, definitely during the filling period, because they're the guinea pigs to test the system, to get all the bugs out and use our learnings from that to then commence the rollout, do our big sell case to all councils from the beginning of 2022.
So Gary, I imagine given that those councils that participate in the pilot are going to be your testing phase and there's advantages for them, you'll probably have a lot of councils that will be interested in participating in the pilot. How are you going to determine that number of 8 to 10?
Yes, so far we've got 19 councils, which was beyond our expectations wanting to enter the pilot. What we're after is variety, Chris, because it is testing the system, not just the connectivity with the council officers that will use the tool, but within council, connectivity to the finance, rate systems and other systems in council. I'm not an IT expert, it's called an API connection. So we want councils with varied systems. So we're looking for small, medium, large councils, rural, regional, metro, and the more variety we can get in that 8 to 10 councils, the better, because that's fully testing the system. Like I said, we want to sell this to other councils, so we have to prove that it works and works well.
Gary, the food safety reform program has delivered quite a few elements so far. Just quickly, what has been achieved to date since the program started?
Well, we've developed several online training tools for council officers. It's just like how to undertake prosecution, seizure. We've also provided to assist councils a number of videos for businesses starting a food business as well. And I must admit, we used a lot of information. Councils have some great things on their websites, so we didn't have to reinvent the wheel. We used a lot. All this was, again, co-designed with councils. I haven't mentioned it, but we've also got a co-design reference group, which has 3 councils on it, the MAV, university, and a number of business associations. So we also run everything that we develop via that group as well, so to get as much user input as possible. We've also developed a guide to the Food Act. So it's the first time, a long time overdue, since we've had a Food Act since 1984. The first question, Chris, you say, why haven't we done it yet? That's a great question.
We've done it now. That's the main thing.
But what we did develop in response to requests from council officers is a intranet, a hub. We call it the Public Health Hub, or for short, the FUB. And so the FUB is an intranet for council officers only. At the moment, it's only being used for food, but it will be expanded to other areas within public health within the department and include tobacco. At the moment, council officers have to go to a myriad of websites within the department to get information and multiple passwords. This is a one password only for relevant council officers to access all their information in one place. And the response we've got so far is really good because we survey councils regularly. They're probably tired of us asking them how they're finding it. But that's because we, again, want it to be useful. And that will have videos, all sorts of information on it, and repository and of recalls from everything, including also a food safety assessment tool as well that they can use to access information about different food types.
There are certainly advantages in having efficiencies, less systems, as you say, bringing all of that information together into one source, I'm sure is of great value to the officers working in this space. Aside from Food Trader, which is coming in 2021, what else have you got left on your reform program to deliver?
Well, right now we're using a program called Moodle. So if your listeners haven't heard of that before, don't worry, neither had I until we got it. It's used by universities. It's an online learning tool, which is using real video to provide different steps that or choices that officers or participants can use as part of their learning. We're starting filming inside a food business for a food allergen investigation and risk-based assessment. 3 days of filming, and council officers will be able to go there, and there'll be sections within the video that they can press on to test themselves against how they would determine a risk within a business, but also takes through the process of doing that investigation around food allergens and a risk-based assessment. We're going to expand that to private water supplies, particularly rural regional councils. They've got several thousand private water supplies that they need to check, which is probably quite risky when you think about it. It's a difficult job for them. Also moving into a very critical role for councils in Victoria is that they are the front line for outbreak investigation in most public health incidences, and will be providing online learning video as for an outbreak investigation with respect to food-related disease.
There's a lot of information in there. I imagine while there's an awareness of the food safety reform program, a lot of council officers might want to find out more. So what's the best way for them to do that? And particularly if they're interested in putting their hand up for the pilot program next year.
Well, we have a very easy email address, just foodsafetyreform@dhhs.vic.gov.au. If they want any information at all. We obviously have our public-facing website, which does have information regarding the reforms. But if you're in the public health space in a council, we can give you a login to our public health hub, and that has a lot more information regarding not just the reform work, but all the work that we're doing for council officers. We've so far sent out 6 food safety reform newsletters to council officers, and so we're quite happy if any senior managers in council want to see that, give them access to those, because they keep all our stakeholders up to date on what we're doing.
Gary, it's been great to hear about the work that you're doing with the program. Well advanced, but some pretty exciting things still to come. So all the best with the work that you're doing, and thanks for taking the time to tell us about it.
Thanks, Chris. It's been a very exciting program. COVID challenged program to deliver.
All the best for the future. Thanks, Gary.
Thank you, Chris.